Good morning. My name's Dr. Gillens. How are you doing today?
Good. I'm glad school's almost out.
Oh, that's great. So your report says you're here today to get a wellness checkup and address any concerns that you may have. And what classes are you taking this semester, and which ones are the most difficult for you?
I'm taking a bunch of biology classes, and they've been pretty hard, but the class I'm most concerned about is Anatomy and Phys 265 Lab.
Oh, really? What are you most concerned about in that class?
We've been going over all the different reproductive systems and how it works.
Oh, awesome. It's pretty amazing how our bodies work and allow us to create our families. Have you had any questions about all of that?
Yes, I've had a few questions about birth control in particular. I saw something on Instagram about how horrible birth control is and the negative side effects that it had on women. I was wondering if any of that was true.
Well, birth control is a very commonly used method to stop people from getting pregnant, and a large majority of people will use it and have mild symptoms and will be able to prevent unwanted pregnancies. There are cases when women have negative side effects to certain types of birth control, but luckily there are many different types of options for women to use. If one method doesn't work for someone, they can always just transfer to another. In one study conducted by Jane Karen, she found that patients who use social media such as Instagram often received bad information from these people due to a lack of knowledge and experience, and people who don't even have medical backgrounds.
Okay then, so what are some specific types of birth control and how do they prevent pregnancy?
Well, there are a ton of different types of birth control options out there, but some of the most commonly used are IUDs, the pill, and condoms. IUDs and the pill use the same concept of thickening cervical mucus and thinning of the uterine wall so that an egg won't be able to place and continue its process of growth. IUDs are placed in the uterus, and the most common type are hormonal, which will cause the changes to the female uterus, which in turn prevent pregnancy. The pill is taken on a regular basis and will have the same effect, whereas condoms are more of a physical barrier to prevent sperm from ever entering the uterus, which will stop the egg from ever being fertilized.
Okay, so my sister used IUDs and had good results, so I would be interested in learning more about how this works to encourage my wife to use one.
Okay, great. So some benefits of using an IUD is that they're long-lasting and highly effective. They're 99% effective, and if you want consistent and long-term solution for birth control, this is considered one of the best and easiest ways to do it. In a study by Rachel Bonema titled Contraception, she states that although they're appointed for up to 10 years, however, about 10% of users will have it removed due to increased bleeding and pain during the menstrual cycle. All birth control comes with some downfalls, and IUDs can tend to be expensive depending on the individual. They can experience hormonal and mood changes due to the imbalance of hormones that's caused by the IUD preventing pregnancy.
Okay, so which hormone is specifically released that will prevent pregnancy?
So within a uterine cycle, estrogen, progesterone, and inhibin are released within the female body. On the latter half of the uterine cycle, progesterone is released, which normally would allow an egg that's been fertilized to implant into the uterine wall and continue its development. With an IUD, however, additional mucus is created that will stop most sperm from reaching the uterus and thinning the uterine wall so that no egg can implant. With certain brands of IUD, the body will stop releasing an egg completely.
Okay, great, so I understand that. This will stop a person from getting pregnant in the moment, but will this have long-lasting effects on the woman and whether or not she'll be able to get pregnant?
So that's a great question. For hormonal birth control options, many people will remove or stop using said thing, and their body will need a few months to restore its normal cycle, and then the woman will be able to get pregnant again. More physical birth control, such as condoms, will just need to stop being used in order to get pregnant again.
Okay, that's great. Thanks for all the information. You have a great day.